Okay, so when do you worry that an ovarian mass might be a cancer? So here we've got our big purple question mark. Cancer? Could this be a cancer? Okay, so this is when you worry. You always worry if you have a pediatric patient that's got an ovarian mass. That's radically abnormal. That patient needs to be referred. In the under 40s, so this is Jem and this is her sister Asia. Now, if Jem had to come with an ovarian mass, I would be worried about it if she had a first degree relative who had either had breast cancer or ovarian cancer, especially at a young age, because that makes you worry about whether there is a BRCA gene cooking in that family. Could also be a mother, if the mother had ovarian or breast cancer at a young age. That would make you think about BRCA. Obviously, these are things, risk factors and things in the history. The nature of the mass itself and the symptoms that it's causing are also going to make you think about cancer or not, as the case may be. But if you've got an under 40-year-old who's got an ovarian mass, you're going to worry about that if there's a history in the family of breast or ovarian cancer in first degree relatives. Then you've got your kind of 40 plus, which is me. I am 40 plus, and that's a slightly different category where you would worry more about a mass. You worry more about all kinds of things in over 40-year-olds in terms of cancer, but you're certainly not going to want that mass to be investigated on an ovary in a 40 plus old person. And most definitely, this is a postmenopausal woman. Look, these are all from the same paper doll series, but she's old. She has to be old because she's got a tight perm that's purple. How much more postmenopausal do you get than that? And she's wearing her nice floral nightie. She's postmenopausal. If she gets a new ovarian mass, that is crazy abnormal. That has got to be investigated. Okay, then the next thing to consider is the size of the mass. Okay, so if you have a young person or a middle-aged person, who's got a mass that is more than 6 centimeters in diameter, that makes you worry that it could be a malignancy, okay? Because things like luteal cysts and follicular cysts, so the functional ones, and teratomas and things like that, usually don't get this big. If they are this big, they could be cancer. And also remember, there is the risk of torsion. So that person is going to have to be seen by a gynecologist for an opinion. And if you have a postmenopausal woman with a mass, okay, firstly, if you have a new onset ovarian mass postmenopausally, that's totally abnormal. And we're particularly worried if that mass is more than 4 centimeters in diameter. So those are kind of risk factors and features of the mass. We're not going to talk too much about the ultrasound features because you don't need to know that. But if you've got a very busy looking mass on the ovary that's got some solid, some fluid, it's got papillary projections, it's just a mess, that's going to be far more likely to be malignant than to be benign. And then, of course, the things that are going to be really applicable to you in primary care, because you're not going to have access to all the scans and all that stuff, is going to be the plain straight up symptomatology. Okay, we're going to get into that in the next video. But if you've got somebody who's got an ovarian mass in any one of these age ranges and they are losing weight, that is very concerning, because we always worry about cancer when people are losing weight. You've known that since day one of first year. Okay, so to sum up, red flags that would make you worry about an ovarian mass: if it's in a pediatric patient, if it's someone who's under 40 and there's a family history of breast or ovarian cancer already. If it's someone who is over 40, you want to look very carefully at that mass. And anyone in this age range where an ovarian mass is more than 6 centimeters. Then in your postmenopausal group, radically abnormal to have a brand new mass on the ovary. You're going to be very worried about that, especially if it's more than 4 centimeters. But guess what? If you think someone's got an ovarian mass in primary care, you're not going to be making these decisions because you're going to refer. And the things that are going to prompt you to refer are going to be the symptom complex. And that is up next.